at OSU, I work on the stroke unit. So I do an educational class once a week, and I do provide information about basic neuroanatomy, what's being impacted and why. And with aphasia specifically, I just explained that it is frustrating. But we have great speech therapists at Dodd Hall that are constantly working with the individual. And what we know about stroke is within the first 3 months is when you expect the most amount of change. That's not to say that your recovery stops after 3 months. It's just that the first 3 months is when you notice the most change. So a lot of times I'm telling family to be patient, to keep encouraging the individual, because we also know if someone develops post-stroke depression, it can get very easy to just say, what's the point? I don't want to do my therapies. I don't want to get out of bed. I just want to stay home. I don't want people to see me like this. Well, when they do things like that, they're less likely to make a good recovery because they're not able to do the things that are going to help them recover, like do their therapies and going out and practicing. With expressive aphasia, I know a lot of times the speech therapist will say, you're going to want to give the person the word, give them extra time. And if they're struggling on the word, give them a hint. Say, so if I say, I work at, it's a school. As a family member, they should say, it starts with O, or it's Ohio, and then let me finish it. Kind of get those neurons and everything firing again. Before stroke, we're on autopilot. We can do 1,000 things at once and we don't even need to think about it. After a stroke, everything becomes purposeful, so you have to think about every little thing that you're doing, and it's exhausting. It takes a lot longer. So having family members and friends just who can slow down, take our time, because we got to respect the fact that this person's having to go and process information in a way they haven't had to process before.